What's going on? All right, we'll see how this plays out. I don't exactly have a film crew in here with me, but I wanted to come on and show you guys some band hip mobilization. So I use these a lot. I was working with a runner right now, and we're needing to clear out some anterior hip impingement. So we were going through some of the band mobilizations that I have found most helpful. And so I wanted to put those on a video. I'm going to post it here and on YouTube, but I figured I might as well help out some other folks in the process. So if you're having some anterior hip impingement, maybe it's FAI, maybe it's not, it's femoral acetabular impingement. So you might have the cam overgrowth below on the femur, or the pincer overgrowth on the acetabulum from a bony prominence standpoint. It's not super important, but if you got pain pinching in your hip when you run, or when you flex your hip, or when you squat, these might help you out. So what we're gonna do, we've got a band that we're gonna use stretched and anchored to a stable surface so that it doesn't fly off and hit you in the face or anything. And we're gonna get that seated up into the hip joint as far as we can go. So if I'm doing my left hip, which I think would be more camera friendly, so I've just got this guy anchored all the way up here, so it's not pinching anything important or getting in an uncomfortable spot, but we're gonna get it all the way up to the top. So now this band is anchored behind me, right? So this hip joint, it's a ball and socket joint. It's got a roll and glide. So if it's rolling upward, like if I'm going into hip flexion, as my hip rolls up, it has to glide down, or it's gonna kind of hit the roof of the hip socket, so to speak. So if you don't have enough room between the ball and the socket, then we either are pinching like anterior labral tissue or soft tissue or some structure up in there, and it's giving you that anterior hip pain. And I always say then it's kind of like if you bite your lip in your hip. If you bite your lip, it swells, you keep biting it. If you bite your lip in your hip and you get swelling and you pinch some tissue in there, keep swelling, you keep pinching it. So first we've got to kind of get that inflammation calmed down. We've got to go through an inflammatory rest phase or anti-inflammatory rest phase. And then these hip mobilizations are awesome for clearing out that joint. So what we're going to do, we've got a band here. We're going to get in a quadruped position. That band is going to give you some joint distraction. So as I rock back from here, this band, as my hip is rolling up, the band is helping it to glide down, okay? So this is me closing down my hip joint as I come into there, and the band's giving me a nice distraction. I can also do this because here the band is getting the least amount of tension when my hip is in the most flexed position. If I want to flip this upside down while I'm laying here, now as I pull the hip up toward me, the band is becoming more taut. So these are both inferior glides, or like long axis distraction, but really it's kind of an inferior hip mobilization there. This is great for clearing out that pinching in the front of the hip. If I wanted to switch it to a lateral traction, I can simply do this. If you guys can see that, so now the hip is still anchored all the way up here, but I'm in a position where it's pulling directly out the side of me. And now as I hinge back, I'm getting that constant lateral traction force. I'm going to switch to the side so you guys can see this a little bit. I'm getting that constant lateral traction force, which is, again, distracting that hip out of the socket from a medial to lateral position and allowing for a little bit more space or lack of impingement as I go into more flexion. Same thing if I want to flip this upside down into an unloaded position, because sometimes that loaded position is a little bit too aggressive. I can flip up, still got the band on a lateral translation point, and I'm pulling the hip in towards me with that constant lateral traction force. So those are just like 4 easy transition ways if you're rolling through like a functional warm-up. These are great for squatters, especially. Squatters get anterior hip pain all the time. But to just kind of loosen the hip up, get some lubrication in it, and get it into those ranges of motion that you're going to be loading without really aggravating the tissue. So I think it's important to kind of have some of these in your toolbox that you know to sort of jump into when you're feeling those symptoms happening early on. So again, that you don't really trigger that inflammatory response, that then we have to sort of pull back, clear out the inflammation, and then start to work from there. So hope this was helpful. Try some of these out. Let us know what you think. There's also a great self hip mobilization that if we get some questions or people commenting that this was super helpful and they want more stuff like that, I might throw that self hip mobilization on here as well. But hope this was helpful. Enjoy it. Have a great day, guys.